work on these courses. These courses have the name educational. It's crucial dissemination of educational and the technology. The use of the lasers for dentistry, aesthetics medicine, and physiotherapy. Let me introduce myself. My name is David Bosco Lanzoletti. I have been involved in the scientific disseminator and the training about since 1989. My collaboration with the many types of university in Italy and in the external. I'm an honorary member of the SNOI and the CD. SNOI is a Society of Odontology Dentistry in Italy, and CD, Society Hygienist Dental. I'm manager of the Creation Academy. It's a network that have about 5,000 professional dentists, medicine, aesthetic medicine, and physiotherapy. Creation Academy offers a role that included publication relating to the use the protocols individual device. In this case, for example, the book to the user the laser diode. The name is The Futures of Dentistry, diode laser. This book is written in the three language, Italian, English, and Romanian. The types of the courses that Creation Academy made, it's educational, same it is. Okay, scholarization after the medical device for different types of medical device, in-depth one or types of the courses online, about 1 hour every 2 months. Okay, in-depth 2 courses in the person during about 1 or 2 days. Another service in the packed courses, it's the help desk telephonic. We don't perform remote diagnostics, we don't my role, but we do provide the guidance on the correct use of the equipment. This is an example, the types of the courses when after the theoretical part, I need the tutorial for the patent. The sponsor of these courses, the Creation Academy, it's a creation company. Creation company are the asset of the NB Electronics. The old NB Electronics is the big company that made the products for the big march in every war. Have the biggest structures in 2 warehouse inside the produce and design, manufacturing, and the certificate. This is the number, the society have 8 million euro in the year, 2,500 meters square for the produce, 40 professional. This company produces 4 types of the laser. One electroporator, I speak this after this course. One easy root, the machinery for extract the tooth, the surgical, and intraoral welder for immediate loading in the implantology. And 2 machinery, micromotor, dental surgery that produce in joint venture with a company, Korean company. Every product have a marketing pack, but this we see later. Okay, familiarized to the types of the laser. The laser is acronyms for the light amplification simulate emission of radiation. The photon. The photon is packet of energy that have no mass, but they have like mass. They encountered obstacle, and their energy become the heat, transformation in heat. The important we laid for the dentistry is 810 nanometers and 635 nanometers. That you may easily see between the 400 and 700 nanometer in between of the colors diagram. Before the ionism types of the wave, after the infrared. The difference between the home light and the laser, home light, divergent light, the laser light is collimatic, the monochromatic. Every the photon go on parallel, okay? And so much important the monochrome. Some tissues absorb the light only at specific bulb light. In this case, it's much important endogenous chromophores, hemoglobin and melanin. They absorb the tissue when we inside have the hemoglobin and melanin. In case this is not present, it's possible to use the exogenous chromophore. For example, povidone iode, the name commercial name betadine, methylene blue, and toluidine blue. Attention, methylene blue have a problem when the patient have a deficient the glucose 6-phosphate. For the case the Fabies, I don't like they use the peroxide, for example, inside the pocket. Many publications speak the hydrogen often referred to as the periodontal irrigation is not recommended because it's considered too cytotoxic and causes the scary microfibrosis, slowing the healthy and the formation of epithelium attachment, reduce the scaling. The tissue reaction on the lesion burn, absorption, transmission, scattering, and reflex. You remember reflex, they use the glasses, safety glasses. The 5 biological effects of the 810 nanometer, anti-inflammatory, physiological, analgesic, hemostasis, the non-contamination is so much important by stimulation. In the study of the pediatrics, it's possible to use any types of the instrument for go these types of effect, but only one it's possible go only with the use the laser, and this is the biostimulation. Anti-inflammatory action thanks to the action of the prostaglandin, cytokine, and interleukin. Analgesic effect, it's possible effect made, they use the laser for the polarization, the node de Tour-Ranvier, reduce the nerve stimulation, and resulting for nociceptors, reduce the transmission of the electrical transmission in the Wine de Schwann. Hemostasis. I have the hemostasis because I have interaction for the iron inside the hemoglobin. The contamination of these types of effect, thank you, 2 types of the effect. The one effect, the thermal action of the laser radiation, also the elimination of the pathogenic bacterial, floral, and disgrade of pathogenic macromolecules above fighting grades. The second effect, the 810 nanometer laser active the photosynthesis of the produced the single oxygen, causing the degradation of the organic material, for example, methylene blue or protoporphyrin. By stimulation, the effect most important have two components. The secondary leg 635 nanometer interaction with the proline substrate of fibroblastic produce the collagen types free collagen. First side is to the mitochondria, the action of the Krebs cycle by acting on the producer of the phosphate. Remaining under the threshold of mutagenic on the teratogenic radiation because 810 nanometer is not ionizant. Later, we have spoken that ionizant light between the 44, 5 nanometers, the blue laser, okay, infrared. Don't infrared, sorry. Biostimulation, this is precisely in the reproduction of the cellular tissue translates into the change in the Alden times. For example, if on a variant operation used the blade, scalpel, holds in 10 or 12 days. With use the laser, the same result is obtained in 6 or 8 days. I wanted to choose the laser is a 5K element choosing the laser of dental use. The cooling system design, the terminal types of the fiber, the quality of the fluence, the wavelight, the types of the wavelight, the number types of the wavelight, and the source, the types of the source, the construction. Think of the semiconductor with the p-n junction, the current electric to migrant from the n region, the quiescent condition in the movement condition emit the pocket of the energy called photon, the photon between to the myron. Okay, the distance, the myron, determination, the types of the wavelight. The theoretical, in this video, we see the photon R-bar. The selection of the wavelight is done the means of the medical structures. The wavelength depends on the distance between the myrons of the optical cavity. The longer, shorter photon become heat. Only the wave at the distance, the dimension of the distance, the myron. Another types for small or the big become to the heat. For this motivation, it's much important, the first element for the choices, the design, the laser. Therefore, it is essential to have an adequate cooling system to emit constant power. For emission to constant power, it's most important the cooling system. The choice can make difference between a positive result or the failure to the protocols. This is, for example, a negative clinical result of the exposes the color desensibilization. The possible then no make the goal because have a peak of the power, and this is not good for finish the protocols. Another important difference is MPS. In the MPS, so much important, the fiber go on every MPS. Don't have tips, okay? The system with the tips cause the loss of power and the light quality. and consistent, it's approximately 10 times more the continuous fiber. If you have a point interruption of the energy, is no good for the final condition of the protocols. Reduce the fluence. Okay, I want the big fluence. When I have many particles touch the cells, I have a big fluence, many particles. Okay, when I have a low particle, I produce a many power. I use many power is not good for the cicatrization. Okay, I want the low power and the big fluence. If you use a wavelet that is consistent with the clinical object in the normal for the device to define. The cells are about 65% of the water. So if they use a laser with a wavelength of 8 nanometer, its affinity for the water causing the tissue necrosis, no apoptosis. I want only apoptosis when I cutting the tissue. And for I have apoptosis, I use the 810 nanometer, no 8 nanometer. Okay, it's not good, these types of the wavelength. There are some the laser, the laser that have a wavelength 880 nanometer are not suitable for medical protocol. It's good for another types use, no the medical you remember the Professor Scarpelli, the so much important professor of use the laser in Italy, is a well-known the publication on the photodynamic therapy recalled the using the diode that emitted light above a deadline 830 nanometer. The high power level must be used because this laser exhibiting high absorbing by intercellular water is no good for the dentistry. Another professor, Dr. Para, this is a choice, is the news. In Italy, Dr. Para renewed the physical of Italian National Sky team. It is a pioneer for the use of laser in the old book. You speak the 810 nanometer laser, excellent for deep biostimulation. And in the 880 nanometer, the stress, thermal stress, no good. Another important for the choice, it's the first light and secondary light together are the diode, no LED A1 diode, okay? The 635 nanometer, it's diode, the 810 nanometer, it's diode, and together for records to the fiber. In this case, in the China produce, use the LED for pilot light. It is not good for no therapy because LED don't have brilliance. The brilliance is the starting of the fluence. Oh, go to the protocols. The protocols derived from the Science and International Scientific Publication and reviewed. Okay. Element that constitution the protocols is the times, the power, focalizing, and the fiber activated or disactivated. The fiber activated use the protocol for the surgical, for desensibilization, for ablation. For fiber disactivated, I use when I want to make the protocol periodontology, endodontics, and biostimulation. What's the difference? For example, this is activated fiber. When I touch the chromophore, okay, we observe the fiber activated. The light particle concentrate on the heat, on the fiber, generating heat. If you want disactivated, when the fiber is turned off, cutting a few millimeters of the fiber, the light burn widens and the height and the types of disgrace. In this case, I open the fiber and the photons go out. Periodontics. Okay, step by step the phases. Measure the deep pockets. The station for the starting is recommending that they use the water with inside the ascorbic acid. In other classes with the povidone ion or the betadine, okay, I use inside the intramucosal into the gum, the tooth, okay, use the water. And second time, they use the betadine, okay. Okay, change it. Okay, the second step, the third step in this case. Now using the blue needle, introduce the distilled water and the vitamin C solution between the tooth and the gum. Attention for the patient that have allergics to acetyl salicylic acid is no good. Use another types of the products, okay? Second time, I use the methadone, povidone ion, and now you take the fiber, disactivate the fiber about 1 watt of the power for these types of the wavelength, okay, 810 nanometer and secondary light 635 nanometer, okay, and go mesial and distal mesial, okay. Don't touch the finish of the pocket, about 1 millimeter of the finish of the pocket, and decontamination. Every about 10 seconds, you're cleaning the of the fiber, okay? If the fiber activated spontaneously due to excessive bleeding, remain in the pocket about 5 seconds, and movement quickly, evaporate the trigger, they remove the fiber and the cut off, okay? And go repeat the treatment of the contamination. Decontamination only with the fiber deactivated. In second time, you take the fiber, the cleaning, and the biostimulation, about 1 minute, about half centimeter the distance, and a little road next to the dimension of the pocket offside. This is example. Every step, ascorbic acid, povidone ion. This is the courses of the scholarization. I the tutor in this moment. The operating is the first to use the laser. Okay, don't touch the finish of the pocket and the contamination, mesial and distal. Okay, cleaning the fiber and the biostimulation offside the pocket. Finish. When I can consider the contamination, the soucifold, when the three classic symptoms of the periodontal infects disappear, the pain when the chewing, bleeding, and inflammatory. When I don't have this symptom, I think the work is stopped. Okay, the protocols require the 5 section, 1-4 week. Okay, in the first 3, I insert the fiber inside to the pocket. The last 2, don't inside the pocket because I think epithelial is a cicatrization. I don't want broken with the mechanical movement. Only by stimulation, the fourth and the fifth week. And usually, of course, with the pocket that are deeper the 7 millimeter on the one as the 6 or X-ray, the bone is compromised, having the shallow pocket. In this case, use the diode for surgical resective periodontal. In this case of the professional, the Dr. Fabrizio Mani for little country next to Florence in Italy. You think the 810 nanometer don't have action in the mineral component of the bone, but in the organics component, because I have a biostimulation to the osteoblast that develop in the osteocyte, reduce the part the osteoclast, because I use the laser for biostimulation in the mesenchymal cells. You think that the mechanism of also the predictability in the bone scarring prognosis through the use the 810 nanometer involves the laser reduce the antigens. Okay, you think the osteoclasts are to the macrophage. Okay, because I reduce the antigen, I reduce the macrophage. The osteoclast become mature osteocyte thanks to reduce the presence of the osteoclast. This is an example for the use of the laser. Starting with a classic technication for the blade, okay? The contamination to the bone with the drill, and now they use the laser, reduce the antigen by stimulation the mesenchymal cells. After the suture, they continues the biostimulation and the contamination. For implants, I have the good fortune, the collaboration with the periodontics Professor Daniele De Santis of the University of Verona. This is live, is your gift for me, okay? We have two types of the perimplanted. Reversible perimplanted is named Mocosit, interested only the color, okay? When I have these types of the blob, this is composed the blood, the fibroblast and the bacterial. In this case, I use the surgical technique. Okay. When I want operating the closed skin, the mucosit, the same, they use the protocols of the pocket in the natural route. Okay. This is example. I use the first use the acid vitamin C, acid ascorbic. In second moment, I use the betadine. Don't touch with the use the laser for the don't have a problem because don't have affinity with the titanium. These types of the wave light don't have affinity of titanium. I by stimulation the contamination every the color of the connection of the wound and the rod to the titanium. Okay, I cleaning the fiber. I cut the fiber when this is activated spontaneity. And second time, I go to the biostimulation. Every zoom after I have the contamination. In this case, I use the same two receptive technical. I use the blue, methylene blue, Okay, first the treatment mechanical to the zone to the titanium. Okay, and second time chromophore blue dimethylene and they use the laser with the fiber no activate about 1 watt of power for 1 minute every the elements. Surgery, general surgery. I use the laser because I think that the scalpel is no good because bleeding and broken so much number of the cells. The electric bisturi, electrical surgical unit, is no good because possible make the muscular fasciculate muscular and produce many hot and creation the escala. The first protocol is hemostasis. This effect can be activated using the laser with a power range for 1.5 and watt to 2.2 watts, depending on the vessel caliber. Okay, if you have a big caliber, use the power of over 2 watts. The time requiring will be the time the need to stop the bleeding. I see the stop the bleeding, stop the use the laser. Activate the fiber in this case, the diameter 400 micromillimeters. Frenulectomy, the typical use of the laser. I want to reduce the frenulectomy. The is a mower which to the parallel vertical incision, okay, extended to retroincisive the papilla because I don't want the fibrosis interproximal zone in Palatin's condition, opening the diamond shaped windows, diastem, okay, all deep fibrotic structures and excision down to the periosteum. We will use the active fiber with a power about 1 watt and a half. If necessary, can increase 2 watt when they have tissue fibrotics. This is the condition after the surgery. No sticker, no bleeding, no scarring by by scarring the second tension. Okay. The finish the protocols, you make the biostimulation. You see the patent about after 1 week, the biostimulation. If necessary, the surgical action continues bearing interproximal are up to the papilla, the palatal are to develop any fibrotic tissue for the use the orthodontics techniques. This is condition after the 3 day and the 5 day. You know the cicatrization, the fibrina for cicatrization. This is example. You see 2 incisive bleeding, okay, the evaporation, the tissue, the quick movement, active fiber, the cleaning the fiber. You remember the cleaning the fiber because the fiber no cleaning, no good put offside the photo. In this operation, the vertical use the fiber for the open the diastema. The procedure reduces the inflammatory and avoids the bleeding, allowing the holding according for the secondary intention. Finally, we perform the biostimulation at the hyaluronic acid gel, also recommended for the own care to prevent the relapses. They use the gel inside. The lingual frenulectomy for the pathological continues to rehabilitation. these types of procedures is not very different from the labial frenulum. The procedure, except for the anatomical issues that may arise of the flow of the toga, namely the sublingual arteria derived to profound. Okay, if you want the sun's vessel during the process, when the wood focus the light on the arteria and creates the hemostasis. If necessary, cooling increase the power from 1.5 watts and 2 watts. If you touch the sublingual arteria, in this case, for make the hemostasis, you focalization the light. For focalization, stand by for 3-4 seconds, and the hurting the laser, okay, is make hemostasis. This is example. The lingual art, the surgical approach is similar to the labial approach. However, great attention must be paid to the sublingual arterial. Its contact occurs. Just focus on the blending seat rich hemostasis. I repeat, the cleaning is so much important for the good light. They open the diastema, okay, and they use the gel for retention. Okay, intraoral peduncular fibroma. Position yourself at the 45-degree angle to the clinical cleavage plane and incised enter perimeter of the fiber. In the good perimeter, at 55 degree, okay, with the laser, take the fibroma to tone. This is condition after the incision. This zone is a particular stress for the patient because this zone is a buccinator muscle. It's not good for the chewing. A pulid is the same, the treatment of the fibroma. Okay, this is condition after 8 or 60 days. Lingual papillom, the surgery is similar of fibroma. It's in these cases, sliding low power is used to preserve the sensory capacity of the organ. The difference of the fibroma is part of the organ. In this case, have the so much important preserve the capacity of sensory. For this, I use the power low. Don't use the organ. In this case, I use the low power. Don't use the 1/2 watt, but about 1 watt. The time is little so much long, about 20 seconds the difference, okay, but this is possible for preserve the capacity of the sensory of the organ. In this case, I use the laser for don't use the retraction core, but I position the laser perpendicular to the clear and the parallel, the stamp or the abutment in the make the couple the tour the depending of the trickets of the gun bed. There is no risk of gingival recession with use the laser. To different they use the cord, which can happen with the retraction cord. Okay, this is an example. If you have this type of the problem, you reminding the patient in the house for the use the chlorhexidine. But if you have the laser, don't necessarily these types of the comportment. You can also fit denture in the same session. Okay, is the good condition. Gingival hypertrophic cases by nifedipine. This is after and before the treatment. The first check about after the 3 day. The videos I see they use the laser at the brushed in the condition active the fiber about 1.5 watt. Don't have bleeding, don't have use the suture, no, don't have inflammatory. This is a scheme is the zoom. Operculotomy. This is the same, the discourse that have make to the when I see the use the laser with the perimplanted because the laser don't have interaction with the titanium. Okay, we intervene directly into the mucosa and the holding screw. We can do this because don't not interaction with the titanium. Holding was occurs by secondary intention. Can it include the procedure is similar to previous one operculum. In this case, too, the laser is very conservative, does not damage the tooth, and we were able to place the brackets in the same session because there was no blending. Let's now look to the practicals. This is a starting condition. We have cutting the gum and exposition the canine. Okay, this is a condition clinical 3 day. You remember to make the dial stimulation with the together the first light and the second light. This is condition. Now let's see the doctor applies the lidocaine in gel where they use the laser 1.5 watt the fiber active. They open the operculum and then the adhesive for the bracket, placement, traction, and the sensation without bleeding or the stickers. Adhesive, application of the bracket, position, and traction. Stop the dub. Precancerals. I discussed this topic on the recent Snowy conference, which lasted almost 2 hours. User the summaries in the few slides. Okay, only for it's possible to use the laser in these cases. We are three types of operative for the use the laser, but you use the first types for 90% the cases. The solution first of the flap, the using the surgical forget, the pinch, the edge, and the sculling. Leukoplakia, condition to the zone the originator muscle. In this case, we pitch the flap with the tweezer and with the laser fiber position and the 45-degree angle and detach the fibrous tissue leukoplakia. Fiber activated, 1.5 power. The recommended biostimulation after the surgical. you see a patent about 1 week and the second session of the biostimulation. This is condition after the 8 day. Solution number two, when you use the laser to the tissue, no fibrose, don't fibrose, okay? The soft, no fibrose fabric that the brush with the fiber. Don't use the pinch, but the only brush fiber activate about 1.5 watt. And this condition, example, okay, the videos is quickly movement, only with the eye of the postation. Scar by secondary infection. Don't use CTO, okay, without bleeding. The finish of the treatment. If you want to use the gel, okay, acid hyaluronic gel and the biostimulation. I see the patent about 1 week and the biostimulation. If you want the patent, use the gel in domiciliary treatment in the night after, before they go to the bed, use a gel. Brushing this. Solution number three, I think they use tip types of the solution in the one occasion in the year or in the 10 year, okay? The possible use the photodynamics therapy, 810 nanometer, 635 nanometer, with in auxiliary the 5 acid, aminolevulinic acid, okay? When the aminolevulinic acid development protoporphyrin name. So much important in this case that you use the diode, two diode, the light, primary light and secondary light. When you use these types of the technician, extensive lesion, the mix in the anatomic zone, the use anticoagulants, the patent, the possible patent have the hemolysis or hemophilia, or poor immunocapacity of the patient. Okay, in this case, use these types of technician. The combination to the acid and the laser. Standby in the zone, the 5 ala for about 2 hours because development in protoporphyrin name have a process, okay, the transformation, protoporphyrin, protoporphyrogen, corbilogen, and go. This, the finish, the goal is a protoporphyrin name. The protoporphyrin name is the organic rag molecular tetrahedral, they make the shell of the heme. When iron atom is insert into the center, the atom ligand with the oxygen. When I use the laser, release the oxygen, singlet oxygen. This is disgregation of the molecular. In tumor to precancerous the cells, this process is defective, allowing the accumulation of the protoporphyrin. In the cells, some don't have this problem. This defective function, the protoporphyrin in the precancerous cells, allow exploiting the molecular interaction, the photodynamic therapy. In the good cells, don't have a reaction to the protoporphyrin name. The condition is the apoptosis, the implosion of the cells when I use the laser and protoporphyrin name. The process is only possible if you use the two diode, 810 nanometer per primary light at about 1.5 watt, and secondary light 635 nanometers with less about 100 milliwatts. It used down power 5 milliwatt, 10 milliwatt is no good. No reaction for the protoporphyrin. The difference is good or no good protocols. Another use of the laser combined with rock treatment. The rock is a ricostruzione ossea combinata, in English, the combinate bone recondition. This is technical. It's invented by Professor Luca Lancieri of University of Genoa. Following the professor with lines after the surgical preparing the site with the mix of the beta types calcium triphosphate product and then tissue colifibrin. The mixture should have the consistence the professor calling the wet sand. Okay, sand. We best stimulation the contaminated area with the 810 nanometer diode laser and the April regenerative mixture. The fiber is 400 micromillimeter, deactivated with the power of the 1 watt and the time 1 minute for square centimeter. You think the TCL, the construction, the incubatrice of with inside the osteoblast development osteocyte, okay? For the organic structures, the mineral, artificial mineral construction, it's ligand with the TCL Baxter for produce the incubation. Oh, endodontics. The paper. Okay, the first treatment is dental hypersensitivity treatment. The first ask the patient to quantity of the sensation of the pine, the wave. No, we will use the scale 4 to 1. The name is was 1, 2, 3, 4, 5. Okay. Second step, while use the hydrogen peroxide to the change to the pH of the dental tubule, the causing them open the filter. The patent with the cooperative don't anesthetize because I need to know how they find the sensation as a challenge of the procedure. Okay. I use the peroxide for the open the tubular, change the pH. And second time, the third step, I use the small brush to spread the thin layer fluoride gel over the affected area. The tubular is open and spread inside the tubular the fluoride gel. Okay, that's much important, the percentual over the 3% or 4% or 5%. It's good. Okay. The fourth step, with the fiber activated at low power, 0.3 watts, 3 milliwatts, touch the gel to evaporate the water. Okay, disconnect the water to the gel and disconnect the fluoride molecules fall into the tubulars and close the tubulars. That with the close of them, I will stay in the area for about a minute, 1 minute. Okay, making a small circle, in the area. Very important. This is different to the good the treatment or the no good the treatment. For the 10 minutes of the procedure, the patient should no rise, don't drink, don't spit, but remain still. Okay, this to ensure the tubulus is closer as the cold open to the thermal shock. If you use the area, thermal shock. If you use the water, thermal shock, they open the tubule. It's not, this is no good for me. following the rule will make the difference between the activate goal or the failing. A second session is possible if the first on the previous successor. This is happening if the tubule closed, what no respect of if the gel is a poor quality or the low fluoride content. Okay, if you use the low fluoride content, it's possible to use the second session in the only one occasion. Okay, it's a logical. This is a procedure doesn't not work in the calcified or atrophic dentin because I think it's possible to use this technique when the tubular is not mobile. Okay. As shown in this video, they use proceed, open the tubule, spread with the brush the fluoride, and now a little circular operation in the zone, evaporate the water, disconnect with the gel, and go down the fluoride in the tubule and the close on the tubule. Stand by for 10 minutes in the finish. After the 10 minutes, I check in with the air, the pine, the sensation pine, the patent. Okay, the reticle pole capping. In this case, I cannot be done because the tooth is rotten and the pulpectomy is necessary. Pulpectomy is treatment of the canal. Okay. In this case, it's possible because the pulp is soft but pale. The mange is recent. I can't performing the pulpectomy, no pulpectomy, and preserving the cavity. I activate the laser, the fiber, and apply about 0.8 volt. The light bound to the lesion. I solve the pupil clean and the form of the collagen retin and hard to the touch. Okay, in this case, the collagen is hard to touch is good. Is don't hard to touch is not good. The pulpectomy, no pulpectomy. Okay, the laser process lasts about 40 seconds in the zone. Root canal, in this case, pulpectomy, when in the possible, they use this technician. The canal treatment, the microscopic imager, the fecalis bacterium, which I know they're very choreacic and resistant. In these pictures, Arnaldo Castellucci, you don't know the Professor Castellucci, showed the bacterium like it's difficult digest with the hypochlorite wasnel. Therefore, after the mechanical polishing, they use the 810 nanometer diode laser is recommended. Okay. Don't use the fiber activate, disactivate fiber, 1 watt of the power. They use the technician to the crosscraft because of the liquidal movement. Okay. Step 1, they enter the canal with the laser off. Okay. The reach the apple with about 1 millimeter. I don't want to touch the bottom. They activate the fiber, turn on the laser, turn on the corner area of the tooth with a spiral motion. I possible use the fiber 200 millimeter, 1 watt. Once the urge the coronal area of the tool, return still used down a spiral motion toward the apex, being the careful not to touch it. I repeat the movement slowly for 10 or 20 seconds, emitting 1 watt, the power condition and mode deactivated. In the same appointment, there are 3 decontamination action with times varying for the 10 or the 20 seconds for the each in relation of the each or the other. Okay, in this case, retractment. Okay, the dentist remove the temporary film with the drill. The mechanical modeling and the sodium hypochlorite are done. Then the laser use the fiber is disactivated. When I stop it, we can close the canal route in the same session. Okay, close it, finish the work. Okay, can I possible use the laser in apicectomy? Yes. As is well known, apicectomy involves two fundamental steps: removal the apex of the severely bacterial infection to tooth root, following the contamination and biostimulation with the use the laser. After the mechanical decontamination, as the laser can be used the contaminated stimulation surgical area to dissolve the granulopathic. Possible use laser. Don't use the another types of the instrument, for example, the plug, but I use the laser for dissolve the glutepack. I possibly use the laser for the treatment of abscess. In the cases of the abscess, we must first address the primary causes. Next, we can work directly on the abscess bed, okay, and evaporate the surgically. We will use the 1.5 watt energy the source with the fiber diameter 400 micromillimeter active and in contact in this case because it is surgical effect. Okay, activate the fiber for the hotting inside for the time necessary for evaporate abscess, the dimension of abscess. Oh, odontogenic fistula. This is a procedure involved of the use the 2 micromillimeter fiber and obviously the primary cause must understand first that with the laser off, well, insert inside into the fistula, only the diameter also it, okay, and while continued unit become difficult to do so. When don't want to the repeater the fistula canal, when the well can longer enter, while the stop avvio the causing damage, activate the laser, pedal, activate the laser, and come back any very slowly, okay? For the contamination, the zone, the canal, the fistula. Bus stimulation. This is for most important protocols for the use the laser. Or the paper, or the scientific paper for the bus stimulation. Up until now, we will already discussed the stimulation is a complementary treatment. Now let's see how it can be performed independently of the protocol. It's possible to use this protocol independently of the first protocol. In this case, the protocol consists in the 4 consecutive sessions spaced 7 days apart. During the procedure, the focalizer and the pace of the active the fiber, for example, this is another type of the and the pace. This is the focalizer. Okay, in the finish, this is the distantiality, and this is at the length. Okay, the curvature of the length make the most power, the big power in the finished distance, 2 centimeter. Okay. If you want to defocalize, use defocalize and the piece, use 1 watt for biostimulation. When you want to use the fiber, use the half watt, if only for biostimulation. If you want to use together biostimulation and decontamination, you use 1 watt and half, 1 watt for biostimulation and decontamination. Only half watt biostimulation, 1 watt for biostimulation and decontamination in together use. This is for example of the laser protocol for biostimulation and decontamination from the clinical condition post-extraction socket. In this case, every the interaction for the laser and tissue, hemostasis, decontamination, antiphlogistic analgesia after the infiltrative anesthesia, and biostimulation. This is described in many paper scientific, but in the one in particular that have in collaboration with the student of the Sapienza University of the Roma, is experimental for the 15 patent they use the laser. 25 don't have used the laser. 25 have used the laser for the post-extractory the socket. Another types of the use the laser in biostimulation is the chemio-induced mucosite. In case of the contracted duty induced the mucosite, such as chemotherapy-induced mucosite, biostimulation session can be performed to promote the solution of the lesion with a few hours. Typical complete healing of the treatment occurs 48 hours after the procedure. Osteonecrosis. This protocol is very delicate. I lose the tissue. I will never get it back. I will have to be very careful how the mucosa. It involved the small ablation and the biostimulation. But the biostimulation, I continues for many sections, about one section on 1 week, about 5 or 10 weeks, okay, the session of the biostimulation after the only one small ablation, so much small, only for the activation of the tissue in the perimeter of the osteonecrosis. The after, with the biostimulation, we can also turn the cancer source, whether the larger or small after. Okay, this is in two types. We use the two types different of the protocol. One with ablation, when the after is big, I want ablation, the brushing in the active fever, the brushing, okay. In the second case, when the after is small, it's possible only biostimulation, desactivate the fiber, the power about 1 watt, 1 watt and half, okay, only biostimulation. I see the change of the color of the after. If it don't result, I take the active the fiber and brushing the fiber the after. About 2 days for result for the goal. Herpes labialis. In this case, we can perform the biostimulation if the herpes isn't bleeding. If it's bleeding, we need to activate the fiber at 1 watt, okay, and pass the getting over the area for about a minute unit to small escara form, and the brushing the zoom, okay, little circular in the zoom, concentric circular. This is a result about checkup 80 days. Bleaching. This is protocol it's possible make the hygienist in Italy. The laser is a certificate for the use the hygienist for 4 protocols: bleaching, pocket desensibilization, and biostimulation. Okay, this is one the protocol. It is possible to use the hygienist. Operating principle Operating principle, the bleaching, the laser light induce the hydroxide peroxide separate the two oxygen atoms from the bond with the hydrogen. Okay, so as they create the free radicals ready to break down the organics component on dental stain. Okay. The question, can I use the laser with the carbamide? Yes, it's possible. Use the carbamide, the peroxide. The difference will be the action, the time from when the products it's activated. Usually, this is double the times, but otherwise are disable to read the left supply with the product. The time is right in the sign. The protocols involve the radiation, each tooth individually, with the focalized laser beam for about 30 seconds. After they apply the laser, lets the hydrogen peroxide active to the duration recommended the manufacturers, about 10 minutes. Use these types of MFPs for the one tooth, the circular for 30 seconds, or you use for any situation for the 4 elements for 2 minutes. Okay, don't worry. The protocol involved the radiation, each the tooth individually, with the focalized laser beam for about 30 seconds. After applying the laser peroxide, the duration recommended by manufacturer. It's possible, if necessary, repair to operating to single element part of it. This is example. Okay, they use the peroxide for the bleaching. The color control the peroxide, the laser, 30 seconds for tooth and finish. Use this, the circular. Okay. The winter must be colored to the work with the laser. The important thing is that as the good percentage of the peroxide over the 35%. I must be mixed well or tooth component and spread to the tooth, the converting of the interior. They use the fork and the pierce is not recommended as they don't not provide unit fly beam delivery or consistent depigmentation effect because the verge of the light is no same the verge of the left or the right. Okay, it's not good for distribution of the light. Okay, the question, when I use the biostimulation, it's possible I damage the zoom? Answer the question is no, not. If you use the good laser, the 810 nanometer, the 635 nanometer, the laser with the power between the half watt and the 1 watt, it's possible to use the full glass rule apply. The glass, when it's full, the water put offside. The same, the energy, when is so much energy put offside, but the transformation development in excess to energy, it escaped like the water over 5, the glass with the demand of the cellar. Okay. In the Romania, the dental hygienist also of a university degree. I thoroughly believe the synergy between the dentistry and the hygienist. So I encourage dentistry to delegate tasks to hygienists, including the periodontal pocket, the treatment, the teeth whipping, dentin desensitization, and biostimulation after the surgical process. I spoke about the third CD Congress in the Roma. I sponsor for the hygienist for the matching with the hygienist and the dentist. Okay, I finish the protocols for the dentistry. Now I go to see the protocol for dermatology, aesthetic medicine, arteriovenous, physiotherapy, safety, and little discourse for the odonto marketing. Dermatology. I possibly use the laser to the wart. The wart is vaporized with the 400 micron fiber, removing the outletly the tissue. Iodopovidone can entrace the effect if you want to use the iodopovidone. Okay. After the ampling, regenerative gel and biostimulation, Alin take about the 7 days about. Chelite, I possibly use the laser as the 400 micron optical fiber, gently brush over the lesion to vaporize the area, brush it in the area to the chelite, okay? You remember that fiber, the cleaning during the treatment because the flustulate put inside the head of the fiber. Xanthelasma is so much difficult treatment. This is for the dermatology. Okay, you have the height for the use for this procedure. A patient saw the word dark protective the godless converting the under years area using and activated the 4 micron fiber gently vaporized the superficial tissue of the exanthelasma without deep penetration, with careful follow-up after 50 days to assess cosmetics result. Okay. In this case, you need to cover the A. I recommend these procedures only to expert hands. Activate the fiber and the melt the ball of the flat, the vaporization to the flat. This is condition after the treatment. Yeah. Okay. We finish treatment. Okay, melanocyte navy. The lower border of the lesion is vaporized with the fiber in the contact used fast stirring movement to minimize the pattern and the time. How did it take about the 7 days without sutures? Or core the area, keep the fiber clean, apply the regenerative gel, and schedule the biostimulation session weekly. The sun exposed area must be covered on the month. You remember the report of histological for check after the procedure. The possible use the laser for begin by vaporizing the lower edge of the lesion using the active fiber 400 micron. The fiber in contact with the tissue. Possible the laser for the papules, in this case to the treatment will be surgical by evaporation of the connective tissue with active fiber. use the fiber, the 400 millimeter, and the evaporation, the zone where the populace is inside. Necrobiosis, this is the same treatment as above. The vaporization and the biostimulation. I checked the patent about 1 week, the biostimulation and good look. It's possible I repeat the treatment or only biostimulation. Folliculates. Biostimulation the session reduce the scarring of the inflammatory. Use of the focus laser beam on the cover the lesion increase the about 2-3 watt the fibrotic tissue that for the 20 minutes with the circular movement 0.5 centimeter for the area, the focalizing every 2 minutes. Up to 6 sessions are to space the 7 days apart, with the monthly check for the 3 months. Just in distance, speed use calling if you patent feel discomfort. Lentigo, diode laser treatment for lentigo is controversial in the paper scientific. A trial on the small area is recommended first. Biostimulation can reduce the pigmentation with defocalization about 2 watt, 2 minutes for area, 1 minute the pause, and the circular movement about 5 centimeter for the skin in up 10 sessions of the weekly. But attention, after the third or the fourth treatment is don't see the difference is stopped, is no good. Okay, the goal arrived at about the 50% occasion. No every patent had resulted. The same for the psoriasis. 2 types of the treatments, the cause is not defined, and therefore the result is not certain. It is recommended the procedure in the same way and verify the first session, the third or the fourth session, and produce with the scheduled plan. Keratosis, the lesion is vaporized for the under emerging inward. If raised, it can be excision of the 55 grad using the activated fiber with holding it with forceps. Lentigo is vaporized with activated fiber using the slow power standing movement with evolving the basal membrane to favor the pigmentation changer. Results after the 10 touch-up healing takes 7 days. Every hyaluronic acid amino acid gel following the stimulation and the cover some exposes areas for the 1 month. The fiber is activated at the 2 watt, but reduce the potence of the protocol. The protocol power is 0.3 watt. Only activate at 2 watt because you activate the fiber. The low power is not good for activate. Okay, you go the activate 2 watt when after you have activated for the protocol, the surgical use low power 0.3 watt, 300 milliwatt. Same these types of the protocols, scar condition use the ablative technique and the sublime for the permitted the post-operative of fibrotic scar, not depression, no accumulation tissue, but ablative tissue. Use the conservative power starting at 1 watt and increase as need active fiber. This example use the povidone iode, activate the fiber. Okay, the brochette, the zoom, use the air for the calling. In this case, we use the power law about 0.5 watt. When I change the color, I stop. I see the pattern about 1 week and by stimulation after the treatment. Okay, aesthetic medicine, dermatology stop, aesthetic medicine. Disease courses is educational, the treatment is compare the treatment. Okay. In my book, I present six aesthetics medicine protocol related to photo regeneration. They are using active ingredient and free without. Each the group provided their level of the basal or the skin's maturity. Different type of the skin maturity, I use different types of the protocol. Free with the active ingredient, a free without active ingredient, only by stimulation. Is a choice in the case of the patient. Biological dynamics organic tissue. Okay. Some damage due to not pathological, only dermatological, non-pathological pericancerous, only aesthetics damage. Okay, damage. Overexposition the sun. The damage causes the overexposition to the sun. It's necessary pathological, no, not for necessary. But I can still be the very annoyed into unexpandedly aesthetics placing. When the explosion is excessive and the physiological responses are insufficient, the laser therapy can be used to remedy this. The benefit of the photodynamics, the main benefit is the technology are the fiber division collagen, elastin reconduction, reversing to negative effect of the UV rays types AB, cellular biostimulation. The treatment with the activity ingredient involves the pre-glazing the tissue, followed by the application of the thin layer of the serum with hyaluronic acid on the area to better treatment. This is an example. I use the serum of hyaluronic acid, don't infiltrate, only by stimulation with use the defocalizant ADPs, okay? Only by stimulation in the zone. I stimulate the microcirculator blonde. And this is the condition, the different condition after and before is remaining inside the barcode, is open the barcode. We move the hand pills over the hyaluronic acid, which will help kill the smoothie across the terms. We use the small circular motion over the entry effect area, spending about 1 minute for square centimeter, about 20 minutes in every phase. This is the condition after the treatment, dehydration, the zone, post-dehydration, hydration, the zone. Okay. After, between. In the condition the same, the barcode in the left don't use the laser. In the right, I have used the laser. The barcode in the right is the ghost. Okay, in the left is present. Can I use the laser when I use the fillers technication? Okay, relative laser biostimulation helps minimize the patient discomfort during the infiltration and afterward reduce the swelling and the risk of localized infection. Okay, I go to the arteriovenous. Uh, I assume the arteriovenous because I don't have many times. Okay, I possible make the arteriovenous in the hemangioma, cuneiform and flat. In different I have different protocol. In the cuneiform, I use the defocalized and the PS, which I use a high power, about 2 or 3 watts. When I treatment the flat hemangioma, I use these types of fiber, the 400 micrometers. I activate the fiber and brushing the zone of the hemangioma, they create the eschar. Okay, when eschar put down, the hemangioma stopped. Okay, I use the laser for the treatment of rosacea, all in these protocols, all in these and the PS for the protocols, the biostimulation about 2 watts. Okay, the possible use the laser for telangiectasis in the face and the leg by the difficult. Don't it's don't impossible, but difficult. You have many patients. You think for the treatment about 10 centimeter of the zone, the quarter, okay, the telangiectasis, if possible, you have about 1 hour the work. Okay, it's so much same simplified to use the laser for the spider because you touch a little touch of the spider and evaporate the spider. This is example for hemangioma flat. Okay, we see the hemangioma is deflating in resolving. When we will finish the procedure, I'll see a patient again in 2 days. The macrophages will have digestive the residual the blood in tissue. If necessary, we can do quickly a new intervention only for bowel stimulation. Okay, this is example, a telangiectasia. I repeat, a very difficult. The treatment require a lot of the patient. You have to chase the vessel bed. You have many patients. You see the patient about 1 week and repeat the treatment. Okay, go on. Or physiotherapy. In this case, I reassume the protocols of physiotherapy because the concept is only one. The treatment, non-specific painful symptoms. In general, the following are threat, the inflammatory, the scar predictability, and pain, guarigion the pain. Okay. As well, we'll see during the description of the protocols, they are very similar each other because they are the biostimulation protocols will the sling the higher power when where the third to hit deeper the tissue on the lower on the one or the affected tissue is thinner, but the reparation of the movement are similar to each other. The laser don't grade the read the name, the protocol for laser is the same. The epicondylate or periarthrit, the power is the same, the treatment the same, repetition is the same. Okay. The important is the profundity. The power is reduced at the low profundity, at the so much power when a big profundity. For example, TMG syndrome irradiated affect the following the cause of the trigeminal nerve up to the point of acute pain. Use the lens with the diameter of 1.5, 2.5 centimeter, the same this, okay? aiding the contact with the skin on the with like touch and the end piece equivalent with other space. In the some case, the intraoral biostimulation targeting the mandibular condition also performed. The first biostimulation offside, a second inside, okay, the zoom, the tringent zoom, okay, the tringent point and follow it the conformation atomic tringent for TMJ syndrome, okay. The another types of the protocols is the chondrite, fractures, tendinitis, muscular strain, valvules, stupors, epicondylite, periarthrite, finger points, distractor, carpal tunnel, plant fasciculars. When you make the courses of the scolarization, you see every treatment. In this case, I have small times. I assume every treatments for the biostimulation. Okay, you have one old concept, 1 minute emission at 1 watt. We 1 watt the break from the each other, and repeat 5 treatment. 1 watt the go and 1 watt the stop. One time the stop, 1 watt the go for 1 watt, 2 watt, and 3 watt. Okay. In this case, it's a random. You touch the zone, the interest of for the use the biostimulation. Okay, a little concept of the safety, the workplace safety regulation for the use of the diode laser. The LSO, Laser Safety Officer. In Italy, there are specific legislation governing the role of the Laser Safety Officer. The name in Italy, ASL, Addetto Sicurezza Laser, in English, Laser Safety Management. Officer. True, there is no specific legislation in Romania yet. It's good practical to follow the basic European legislation on the optical radiation risk. Okay, European directive, the number 2006-25 EC, concern the protection of the worker of the exposure to artificial optical radiation, IR. This requirement employer to assess the risk associated with laser source and appoint the qualified expert from among the workforce. The first reference related to use the safety of a laser can be found in the use the maintenance manual. Inside, we must find the specific reading to environment in which instruments can be used. Second, what can use device, qualification, and courses. The safety regulation, hygienic regulation of the machine or device, what to do to maintain the instrument's efficiency. How I can demonstrate with the level for the knowledge by attending the courses like this is you receive to certificate, but not only that. A copy of the another over other the attending the courses the certificate. You have a copy of the course syllabus must also detect specifically the safety with discusses, the didactics, and a copy, the third question, will also to pass the course if required to local law. Example, in Italy, it's possible to use this. At this point, the question is spontaneous. The question, how much does it cost and what can be returned to the use the laser technology? The answer the question. It depends on the technology, on the schooling, and the trainer itself. Okay, if you don't have a good technology, for example, you use an 880 nanometer, it's not good for dentistry, you don't return to the investment. Okay, if you use the good technology, if you use attended the schooling, the training, and so. If you use the right technology and avoid the training, you have turnover can improve about the 20% each if you turn is 100 with laser to becomes 120. Okay, when you same the technology, the partner, the patent, okay, it is same, but if you have the laser, you improve it by 20% in 1 year. So be efficient and effective with the laser technology. You need the schooling, the training continues, and the technology. If you use the wrong laser, don't take the courses, the instrument become the knick, the gadget. It's not like you use the table VG60, okay, and the key scratch. I don't use the different investment that of the course. Okay, the difference between the different the investment of the course. If you have the good laser, the learning, you use the laser and have a return to investment. In different times, use only the cost. Okay, if you want a little pause, I will stop with the lasers quickly moving to the some information to electroporators. The same for design, but the different of the technology. Okay, in the case the laser, I make the light. In the case the electroporator, I make the electrical impulse. The laser have the medical device, the electroporator only aesthetic medicine. Okay, the machinery is exposes the last exposition to Dubai, okay, about one month later. Electroporator, transdermical, and medicine aesthetics. Electroporator, what is this? Electroporator is a technology of the use the low voltage electrical impulse to temporarily increase the permeability of cell membrane by creating equipoles, the channel called pores, electropores. About 10 slides, these arguments, okay? Advantages of the electroporation, non-invasive, dependent controller, painless, reversible effect. Okay. Mechanical of action of the skin barrier. The electroporation allows the transport, the produce to the past the strum, the corneum, strum of the corneum and the cell's membrane, converting the active ingredient into the target tissue. The noble Mr. Dr. Agreen and McGinnis discovery water channels avionics in the cell members result the new understanding of the cell permeability, a connection to biophysical principle support electroporation technology for the drone delivery. I know the technology because I already attended my first courses university about in 2017. In seven, Gabriele D'Annunzio Pescara attended the course on cosmetics, eyes, and aesthetics medicine, dentistry, and smile aesthetics. Creation by NB Electronics, present ABC, electroporation beauty care, and advanced aesthetics medicine system, convenient technology, specialized cosmetics, and the protocols for immediate visible results. the active ingredients have been designed of electroporative use. A common base of the hyaluronic acid was for the fit and the seven transdermal passages. We have three types of the products, three types of the protocols for the types of the skin, the normal skin, mature skin, medium, and mature. Okay, use the different types of the protocol, different types of the products. This is the example for the use the electroporation and the pills. Very simply, non-invasive, non-pain. This is the result for the one action, the five. The protocol previews the 5 session. This is the first section. Reduce the clavellary, reduce the around the ear, the nasolabial. The possible make the treatment of the body if you want to use the phosphatidylcholine. This is the cellulite, okay, another types, but it's possible. Or every one machine possible use for the body for the face. The different with another types of the utilize, for example, the ionophoresis. Ionophoresis use the current for a cathode e anode transportation the electrical in the my body and ionization the cosmetics. Electroporation, no use systemic transmission of the current, but only in the side, in only little district, and don't polarization the cosmetics. The different for technician to the electroporation and the radio frequency, the mild vengeance, the radio frequency, the factual treatment include the risk of the overwriting of the burns, and the equipment is not used correctly in the skin aging. Okay. Can I possibly use the combination to the electroporation and the laser? In this case, okay, I have used between the sorry, before the electroporation, I remaining the gel and use the laser for biostimulation, the gel that have used before in electroporation. This is a condition only one session. This protocol previews the 5 session. After, before, after. Okay. Agreement. The business support, the creation provides the customer with solution design specifically for electroporation, no cosmetic market, okay, mass market. Training for the technology, creation, it's possible creation the open day for the patent can be introduced. Electroporation. Informative material to advertise. For these codes, all its lends to exploit the high-tech device for communication with the call odonto marketing. Okay, they connected the clinical technologies, diode laser, electroporation to marketing strategies to attract the new patent dentistry to aesthetic medicine. The 4 P's, the dental connects, the products, the price, the place, the promotion. The application to laser, dermatology, and aesthetic medicine of the face dental officer. The produce new service. The diode laser and the electroporator as extension of the offers. Okay. Integrated the aesthetics, dermatological, and dental treatments. Products, the P, the P for marketing. Positive value, advanced technologies, they are a symbol of the innovation, safety, premium study placement. The price, the strategies, definition to the price consistent with technology, the skill and patent combo brackets, dentistry, aesthetics. Oh, in this case, I assume this is another courses about 2 hours only. I want to speak the odonto marketing. Okay, the place where to provide the service, dental practicals, the multidisciplinary center, integration with the dermatology and aesthetic medicine of the face. You patient, you see you for the um, multidisciplinary center, not only dental center. Okay. Promotion, the communication, the patent education and information, the social media open days, information courses, innovative technical content. Attracting the new patent to the aesthetic needs and into the practical, the network and the loyalty. In transition with be formed dental practices to a wellness network. Okay, not only dental practice, but concept the wellness network. A cross-selling sanitary. Healthcare cross-selling is a marketing and the patient care strategy in the courses of the proposing the produce. The service treatment are complementary to the main one which the patient is allowed burning or receiving. From the aesthetics to dental care. Integrated the patient or the therapy continues. So when you stop the practical the therapy of the dental, it continues with the use the aesthetics therapy. Okay, the training patient event a digital communication to develop the new patient forward. Such. We have with the producer, we have the make the marketing pack, the banner for description. When you work the patent in standby, you see the banner, and then you see the flyer, and you see the video in the geolocalization clinic. This is, for example, on video in Italy. Okay. Okay, this example, the videos in Italian, but give you an idea. With those marketing tools, news patient will feel you knowing that you have the best technology. They will also look for the from Italy map, not only Italy, but the Europe or the world. Okay. Um, this is the part of the marketing page is included the price, the product you choose. Okay, the possible use this for the geocalization. This is an instrument for the dumping sanitary. If you want linking with the Italian, French, Spanish patent, it's possible with these types of the tools. Okay. Oh, okay. I stopped. If you want research my courses, the possible you see in my channel or in the laser creation first of you see me. This is the my contact. If you have an idea after these courses, you send the message in English or in Italian. I respond you. Thank you for attention. I see another courses.